Hi, this is your pharmacist, and welcome to my YouTube channel that is Learn Pharmacy. Today, the topic we'll discuss is type 2 diabetes, and we'll see this topic in simple terms. So, we all know that type 2 diabetes is a multifactorial disorder. It means that it is accompanied by many factors. It is just your high blood glucose level, which is elevated blood glucose level, but it is defined by many factors. And it is a progressive disease. It means that it will worse over time. And the thing is that from this type of diabetes, about 95 patients are effective. Patient population is affected by this type of diabetes. The people who have abdominal fat, that is central obesity, that is a risk factor for them that they have this type of diabetes. If you talk about the pancreas, your pancreas are not dysfunctional. They are making the insulin, but the effect is nil because the insulin receptors that are around your body that cannot sense it. They are less sensitive. So, which we say that insulin resistance. And when you discover that there is insulin resistance, which is a thing that you might have type 2 diabetes, that insulin resistant triggers a cascade of metabolic processes. The first one is overproduction of glucagon because your body cannot, because insulin receptors cannot sense the insulin. So there would be overproduction of glucagon, which will convert glucagon into glucose. And the liver, which store glucose, will receive signals to produce glucose into the blood. And the third is that your beta islet cells will compensate your glucose and they will also produce glucose, which will result into high blood glucose. This is healthy type 1 and type 2 diabetes. In type 1 diabetes, we have seen that your pancreas are not able to produce insulin. But in type 2 diabetes, your cells, your receptor cells, fail to respond to circulating insulin, and that insulin or that glucose is not going inside your cells. That is the main default. The tissues become less sensitive to insulin. I hope you will understand the difference between type 1 and type 2. In type 1, pancreas are dysfunctional, they have failed. But in type 2, your pancreas are doing their work right, but your receptors are less sensitive. I recently said a word metabolic syndrome. It means that that you are having a triad of problems inside your body. You can have high blood pressure, you can have high triglyceride level, high blood glucose, high cholesterol. You can have metabolic syndrome and you can have diabetes. It's not true that you cannot have diabetes without metabolic syndrome. You can have, and there are two specific terms that I'm gonna say in this slide is that impaired fasting glucose, that you have elevated glucose on walking, and the second one is that impaired glucose tolerance, that you have high blood glucose along with high blood pressure and high triglyceride level. And in this slide, we will see the complications, microvascular complications that comes along with diabetes. The first one is nephropathy, which is that damage to kidneys, and the filtration of blood is effective. Your kidneys cannot filtrate your blood as they should. Neuropathy, it means that the damage to tiny nerves In extremities, that are your legs. Retinopathy, it means damage to retinal tissue in the eyes, which cause blindness. And if you think that your eyes are affected, then it can lead it blindness can be a result of diabetic retinopathy, which is due to your diabetes. And in the last slide, I put patient teaching. If you are a community pharmacist, if you are well aware of diabetes, and then you must tell your patient or the person who is suffering from diabetes that get eye examinations, get your cholesterol check, because diabetes results from a triad of problems. Food examinations, because many people who are suffering from diabetes, they have amputations. They have amputations. And annual flu shots, because when you have diabetes, your immune system is compromised, and ability to fight off infections is less. I hope you would understand about type 2 diabetes very well. In my next session, in my next YouTube video, I'll talk about the symptoms. I will talk about the main level of glucose, high level, low level, or balanced level. Stay tuned and subscribe my YouTube channel. And if you want me to do more, then please comment and stay with me. Have a good day.